E. Durkheim, a sociologist, first provided empirical evidence of the importance of social support. His book, Suicide, 1897, showed that lack of social support increased probability of a person committing suicide. The social support health connection was supported by a 9-year study in Alameda County. Men and women who were socially connected through marriage, contact with family and close friends, memberships in religious and volunteer organizations, lived longer. The benefits of a close-knit community have been shown in Roseto, Pennsylvania. Researchers referred to the Roseto effect. The death rate from coronary disease is much lower than in the comparable town of Bangor, Pennsylvania, even though eating, smoking, and exercise patterns were the same. Why? Roseto was an Italian enclave with supportive traditional families. In the 70s, younger generations married those from other backgrounds and moved away. Church attendance also dropped. The rate of heart attacks then increased. Researchers have many definitions of social support. Here are a few. Appraisal support, helping individuals to understand a stressful event better. Tangible assistance, provision of material support, services or goods. Information, suggestions regarding particular actions individuals can take. Emotional, reassuring a person that he or she is valuable and cared for by others. Across the lifespan, females seek this more than males. Effects on illness and health habits. Social support can lower the likelihood of illness. Speed recovery from illness or treatment. Reduce the risk of mortality due to serious disease. Social isolation is a major risk factor for death for both humans and animals. Those with high levels of support have fewer complications during pregnancy and childbirth, report less pain, are less susceptible to herpes attacks, have lower rates of myocardial infarction, are less susceptible to development of new brain lesions if they have multiple sclerosis, are less likely to show age-related decline, better adjust to coronary artery disease, diabetes, lung disease, arthritis, and cancer, are more adherent to their medical regimens, are more likely to use health services. Note that social support does not always lead to positive health outcomes. Consider the effects of peer pressure and drugs. Models of social support. Model 1. Early studies defined social support in terms of number of social contacts. Berkman and Syme in 1979 defined social support as a combination of marital status, contact with close friends and relatives, church membership, and formal and informal group associations. During a 9-year follow-up of mortality rates of adults in Alameda County, data showed those with more extensive contacts lived longer. Research on recovery from an initial heart attack suggests that just one tie may be enough. The mostly male patients in this study were less likely to experience another heart attack if they lived with someone rather than if they lived alone. Remember, not all social contacts are supportive, and stressful relationships have negative effects on adjustment. Coyne, in 1991, believes that harm created by stressful relationships outweighs benefits received from supportive ones. He believes that the key to good health is not having bad relationships. This is consistent with Major, 1990, a study of females undergoing abortions. Additionally, Rook, 1984, studied 120 widowed women and found that negative social interactions were consistently and more strongly related to well-being than were positive social outcomes. Also, providing support causes stress. An example, after the 3 Mile Island nuclear accident, men who lived nearby showed fewer indications of stress if they had a good relationship with their wife. However, women who had a good marriage were more likely to experience stress. Number of helpers available to a person in need. This defines social support in terms of the number of people from whom an individual has received support in the recent past. Those with more providers experience worse health. Although this may seem to be the opposite of what you would expect, it may be that individuals are more likely to seek social support when they need it. Those who have more need usually have more supporters. Model number 3 emphasizes quality. The intimacy model predicts that having close, confiding relation with significant others will be associated with better health. An example: among gay and bisexual men infected with HIV, those with a history of close, confiding relationships have lower levels of suicidal intent. According to Pennebaker in 1990, confiding is important for 2 reasons. Not confronting one's feelings or beliefs about a distressing event requires active inhibition, which is physiologically stressful. And failure to translate the stressor into language makes it more difficult to understand the event and cope with it. The presence of others is not necessary. Talking into a tape recorder or writing things down improves health as well. Model number 4 defines social support in terms of perceived availability. Different kinds of assistance, but emotional support providing reassurance and affirmation is most consistently beneficial. Support must not be thought of as overprotectiveness, because this can make it difficult to engage in behaviors necessary for recovery, such as dieting, exercise, learning to manage pain without meds. Too much or overly intrusive social support may exacerbate stress. Effects of social support. The buffer effect is the interaction between stress and the protective factor of social support. Under low stress, social support is not necessary for good health and does not affect it. Under high stress, high levels of social support should buffer individuals against harmful consequences. Stress buffering effects are not confined to social support from humans. A study looked at over 1,000 individuals 65 years and older and asked whether they owned a pet of any kind, and were asked to specify the number of negative life events experienced within the past 6 months. Having a pet buffered against harmful effects of negative life events. Among subjects who did not own a pet, those who'd experienced many negative events reported more contacts with physicians than those who had experienced only a few. Owning birds or cats did not buffer stress. Pets may provide better support than people. See page 110 in the new edition. Why might this be? Buffering effects are not always found. In a 9-year longitudinal study, there was a direct effect between social support and health. Alameda County residents with more social contacts lived longer, regardless of the level of potential stressors such as poor health practices, and limited financial resources. There is also research on the direct effect of physiological correlates of social support and health. When the presence of secretory immunoglobulin A, an antibody contained in bodily secretions, was measured in college students before, during, and after final exams, those who reported more adequate social support had higher levels of SIGA. Because SIGA defends against infection, this study connects social support with reduced susceptibility to disease. The relationship between social support and SIGA was not affected by levels of stress, which was highest during exams. Research on unemployment disruption, being fired, laid off, downgraded, by Perlin in 1981, illustrates indirect effect between social support and health. High levels of social support in the face of job disruption were correlated with positive changes over time in self-esteem and feelings of mastery, which in turn were correlated with less depression. But we don't know the direction of effect. When others care enough to help us, we feel better about ourselves. It can also go the other way. Those who feel better about themselves will find it easier to establish supportive relations. Or perhaps perceived social support and good relations with others are both products of an optimistic, outgoing personality.